afternoon, everyone. Thank you very much for organizing committee for inviting me for this very wonderful session. Thank you so much, Dr. Kurniawan. So I'd like to present a new direction of future reproductive health and family planning in Indonesia since this topic is quite related with the global health across region. We know that investing in family plannings is an important key to achieve the sustainable development goals. Investing in family planning is a development best buy that can accelerate achievement across 5 SDGs term of people, planet, prosperity, peace, and partnerships. So we can see that investing in family planning is a development best buy. This is in the people, no poverty, zero hunger, good health, quality of education, and gender equality. Planet, clean water and sanitations, affordable and clean energy, innovation and infrastructure, sustainable cities and communities, responsible consumption, climate actions, life below water, and life on land. And then for prosperity, decent work and economical growth, reduce inequities, peace and justice, and partnership for the goal. It is very clearly that family planning supporting our goal to achieve SDGs target, especially in the 5 Ps. Family planning advances human rights, helping reducing poverty, improving nutrition outcomes, saving life, prevent HIV and AIDS transmissions, and also planning support for women and girls' educations, and then advances gender equality and empowerment. According to the planet, family planning mitigate population growth, effect on access to water and sanitations, clean and renewable energy supporter, and then building resilient infrastructures, contribute to building safe, resilient, sustainable cities, reduce population effect on food and chemical wash, address the challenge of climate change, protect declining marine resources, mitigate the effect of deforestation and unhealthy interaction among humans, domestics, animals, and wildlife. For the prosperity, family planning clearly contributes to economical growth, promote inclusive societies by addressing the needs of disadvantaged populations, and also contribute to peace and stability. And by family planning, it will increasing partnership that can support the achievement of SDGs. Empowering women to choose the number, timing, and spacing for their pregnancy is not only a matter of health and human rights, but also touches on many multi-sectoral determinants vital to sustainable development, including women's education and status in society. Without universal access to family planning and reproductive health, the impact and effectiveness of other intervention will be less, will cost more, and will take longer to achieve. This is former General Secretary of WHO, Ban Ki-moon, saving every woman and every child, and for healthy and empowered women, children, and adolescents. The moral imperative of reproductive right, health, and justice. Sexual and reproductive health refers to the state of complete physical, mental, and social well-being in all matters relating to the reproductive systems, and implies that people can have satisfying and safe sex life, the capability to reproduce, and the freedom to decide it when and how often to do so. The goals of reproductive justice, number one, is the raising of children in safe and healthy environment, planned and healthy pregnancies, ending or prevention of unwanted pregnancies, and healthy expression of sexuality. If you look the big spectrum, the huge spectrum of the reproductive health, with a concept from womb to tombs, explaining of us that reproductive health is starting from the female before the pregnancy, during the pregnancy, and then after while childbearing age, and then after delivery of her offsprings, starting from the fetus, adolescence, adult, and becoming menopause. Many problems that are as a barrier of reproductive health across the age. That's why taking a life course approach to the study of reproductive health involves in the investigation of factors across life and also across generations that can influence the timing of menarche, fertility, pregnancy outcome, gynae disorder, and age at menopause. If you look these figures, this is showing us potential impact and benefit through the life cycle, from the pregnancy to neonate to child to adolescence and then to the next reproductive health. Also, we can see life course models with illustrative samples. This one is critical and sensitive period models with or with the effect of later life risk factors, for example, low maternal folic acid status around the time of conception. It will have an effect, negative effect in offspring, and then with effect of later life effect of modifier. For example, extremely low birth weight will induce a poor motor system and inactive lifestyle, and also inducing cardiovascular diseases in the future. Accumulation of risk models, including independent and uncorrelated insult, faster growth rate, presence of stepfather, and war, maybe it can affect the earlier of menarche. And if you look this one, the life course models with illustrative examples, correlated insult risk clustering models, is for example low childhood, socioeconomic positions, it will inducing poor growth, parental divorce, and poor diet, and then will have an effect on earlier menopause. And if we'll have change of risk models, smoking and early menopause, maybe can affect the cardiovascular disease, and then chain of risk model triggers risky sexual behavior in adolescents, STIs such as chlamydia, gonorrhea, HPV, bacterial vaginosis. It will leading to infertility. Life course approach to reproductive health. This is theory and method. This is schematic representations of biological and societal and social factors acting across the life. This, for example, lifetime socioeconomic position, lifetime adiposity, then early life factors of breastfeeding, growth, and parental divorce, at menopausal, and reproductive or pregnancy outcomes, and age at menopause. This figures can be explained that everything is as a life course approach is have a good relationship. The other concept about fetal origin in adult disease, I think David Barker in 2000 already declared that nutrition in you receive in the wombs, the pollutants, drugs, and infection you were exposed during gestations, your mother had instead of wine while she was pregnant with you. All these factors shape you as a baby and continue you to affect you to this day. If you look this one, Indonesian demographic tools, dynamic, yeah, Indonesia is dominated by productive age groups, almost 69% of the populations, according to the census in 2019. And then this is a percentage of people living below national poverty. It's about poverty line. It's about 11, but maybe it's about 9 to 10%. Yeah, for example, and then the poverty rate in 2030, if we only do business as usual, only decline until 5.7. But with a good intervention, the poverty will decline until 4.3%. Also, the same with stunting, where with business as usual in 2030, we have only declined to 22%. But if we do a good intervention, it will decline until 10%. Also, maternal mortality rate, even the last time, our maternal mortality is about 189. Right now, we still use the 250. And then with the intervention in 2030, we can achieve around 130 or 130 over 100,000 life birth. And the other thing also very important, infant mortality rate. Yeah, if we with good intervention, it will achieve 12 in 2030. That's a percentage of smoking in adolescents. It will decreasing until 7.5% with a good intervention scenario. Prevalence of obesity as well in 2030, yeah, our target is decline until around 20%. It cannot only do business as usual. And the last is our total fertility rate, it's about 2.4. And in 2030, our target is decline until 2.1. So that's why the family planning is very important, and it's our coverage of national health insurance. 2030, the target is 100% of our residents have already the national health insurance. When they start getting married, yeah, now it's about 11%, but within until 2020, we hope it will decrease until 6.9%. It's not so easy, but we should try. Yeah. And then health and welfare of women and child survival is a key to nation building. If you educate a man, you educate an individual. But when you educate a woman, you educate the whole family and society. So that's why it's very important for every woman to go to the school and then even go to the universities to have a broad mind in order for improving reproductive health. And then this is almost the same life cycle approach. And then I want to explain about the importance of technology in delivering services for reproductive health. Yeah, right now we have our challenge about the breakthrough is about convergent thinking between life science, physical sciences, medicine, and engineering. That is quite important to solving the problem in health. This is, for example, convergent thinking will accelerate discovery and innovations. Deeper understanding on biological system are given by transdisciplinary collaboration. So that's why very important the support from the engineering, from the science, and also from the humaniora. This is three barriers that we are facing within 2 decades. Number one is genomics, number two, digital medicines, and the last is AI and robotics. And then this is the problem in the community, the new paradigm right now, doctors, rented health services, physician and patient is sitting in the same position. Then consumer health informatics. So that's why every single information that we give to the patients, yeah, should be based to the patient's need, and then to easily make the patient understanding. Because we are facing the empowered patients, yeah, not only the passive patients. So that's why every process should be well informed to the patients, and then not likely more frequently the patient also involved in making every decision for her healthy. For example, in telemedicine activities, it's very important the empowered patients. The 4P in precision medicine is predictive, participatory, personalized, preventive, predictive, preventive, participatory, and personalized. So that's why it is very important to empower the patient. This is one of the tools that we can predict biological age of the patients, and then already published in Apple Store, that we encourage every woman to measure MH to know how her biological age. This is, for example, even the same chronological age but different MH level. So the second patient, they have significantly older biological age, so need more progressive treatment if they want to conceive. Another tools also that was built by us, also the Jakarta Reproductive Health or Healthy Reproduction of Jakarta. This is mobile applications to bridge the gap between the healthcare providers, healthcare facilities, and the patients. Every innovation and technology is very important for the to primary prevention. So we know that big data it's a new oil. Big data, we have a good opportunity. So by using big data, and then we can order the early detection biomarker. That is very important to the every babies that delivered in the world. This is for making early detection. So make us easier to adjust environment and lifestyle in order to prevent chronic disease or degenerative diseases. And then for every mother who has pregnant, we think about the wearable device that can as a facilities to support the word participatory from the four P's: predictive, preventive, participatory, and personalized. So making every people can easily to report their own status of health to the family physician by using wearable device. So that's why, again, this is very important to establish a big data in health in our country. So a life cycle approach to women's health emphasizes three important factors: anticipate and meets women's health needs from infants through old age, emphasize health-seeking behavior and appropriate services to meet women's health needs throughout their life, recognize the right of all women to make informed decisions about their health. And this is the picture how the concept of family planning, starting from adolescence, adult, periconceptions, menstrual cycle, puberty and sex differentiation, reproductive hormone, and the productions, and then adult marriage, immunization, smoking, environment. Then in periconception is prenatal screening, biological age, prenatal screening is quite important. Nutrition, you are what you eat, we are what we eat. And contraception, this is very important to support human capital development toward 2045. If we think about 100,000 first day of life, very important 100 days pre-conception, we should give our patient multiple micronutrient that will improving the quality of the gametes and will directly leading to good embryos. Last, a take-home message: family planning is a long-term investment for building strong nations and related with milestone achievement of sustainable development goals. The concept of reproductive health revealed the whole cycle of life from womb to tomb theory. Highlight roadmap of Indonesian SDGs explains significant factors that is able to be improved through the better family planning program. So that's why family planning is a good investment for every country. Innovation and technology strengthen the future of family planning and reproductive health program in Indonesia. And then the last, family planning is the strongest factor to establish human capital development in Indonesia. Thank you very much for your kind attention. Good afternoon. Assalamualaikum warahmatullahi wabarakatuh.